Angelina.
Hi, how are you?
I'm okay. How are you?
I'm good, thank you.
Thanks for coming in. So, you're here because you have some back problems, back pain. I read in the file that it's been kind of chronic. So, go ahead and tell me, when did this start?
It started up about 3 or 4 weeks ago. I do gymnastics, so I am pretty active.
Okay.
And I've noticed that whenever I'm done with practice, my back is starting to hurt more and more.
Okay.
And it's starting to get progressively worse.
Okay. And where is it located, the pain?
Mostly like my lower back and then like near my shoulder blades.
Okay. For how long have you been practicing the gymnastics?
I've been in gymnastics for about 7 years.
7 years. And have you had any major injuries?
I tore my labrum in this shoulder, but that's about it.
Okay. And any recent falls that maybe you could associate the pain with?
Not that I know of.
Okay. So it sounds to me like we need to do more of a management type of treatment, which could require quite a few sessions that we do every week so that we adjust you and we realign your spine, your shoulders, and your hips, your hip bones. We want to make sure that they are in perfect alignment. That usually helps with muscle movement and with mobility to increase the spacing between the vertebrae. Do you have any problems with the way you walk? Any pain?
No, not that I can think of.
Okay. Any pain in your neck? Headaches that won't go away?
Headaches occasionally. They're not often, but every once in a while when I'm working out a lot, I'll notice that a headache will come up and it won't really go away until I rest.
Okay, that makes sense. What I think is happening is that there is a constriction of blood vessels, so not enough oxygen is going to the brain, and usually that lack of oxygenation can cause, on top of like mental and blurriness and stuff like that, it can cause headaches. So it's something that can be fixed through chiropractic adjustment, and we can definitely help you today. I want to take a look at your back to see what we're dealing with.
Okay.
And then I want to see your gait, how you walk, to see if there's any imbalance in the hip bones and what we need to adjust.
Okay.
All right. Okay, Angelina, I'm going to have you take a few steps towards me. So just walk relaxed and now turn around. I know there's not a lot of space here, so go ahead and keep on walking. Good. And come back. Okay. I'm noticing a little bit of pronation on the left side. Go ahead and turn around for me. So let's take a look at your lower back. I'm gonna put your hair up. Okay, I'm going to palpate, starting with the sacral region. Just really feeling for any pulsations. Muscle movement. Okay, definitely on the right side I'm feeling. Okay, do you feel that?
Yeah.
Okay. looking at the imbalance at S1 and palpating the iliac joints. Okay, a little bit of pronation on the right side. Go ahead and bring your feet together for me. Okay, perfect. Any pain here?
No.
Okay, so I'm gonna have you lift your left leg kind of in a 90-degree angle with your shoulder, with your hips. Any pain when I'm pressing down here?
Very minor.
Okay, now go ahead and with your left heel, push it in the floor in front of you. Okay, and any pain here?
No, it just is a little uncomfortable.
Okay, come back to center. Now with your left arm, go ahead and touch the left side of your knee on the outside. So go ahead and stand up straight. Okay. I'm just gonna show you. Just gonna slide your arm like this, okay? Okay, go. Any pain here?
Yeah, it's super tight.
Okay, come back to center. So we'll do the same thing now with your right knee. Go ahead and lift it up in a 90-degree angle. Any pain here on the left side?
No.
Right? Right side? Where I'm pressing right now? Okay, so go ahead and push down with your right heel in front of you. Okay. Any pain here? Okay. Go ahead and try to touch and bring your leg towards you and try to touch the right side. Any pain here?
Not pain, it's just a little tight.
Tight. Okay. Come back to center. Let's go ahead and take a look at your shoulder blades. Okay, so go ahead and try to relax your arm. Just gonna try to touch the middle of your back. Any pain when you're doing that? Just gonna press down in your palm. Let me know if this hurts. Does this hurt? Any pain here?
No.
Okay. Let's go ahead and do that on the right side. So relax. I'm just gonna guide you. Okay, a lot more flexibility on the right side. Any pain here? Okay, relax. All right, now with your left shoulder, so you mentioned that you're having pain in both shoulders. I'm just going to palpate as you're making and doing some movements.
Okay.
So we're looking for any dysplasia. Good. Now lower it down. Back to center. Perfect. Any pain here?
It's just a little tight.
Okay. Okay, now go ahead and move your arm above your head. Any pain here? Okay. Come back to center. Okay, go ahead and move your arm again, just in a 90-degree angle. I heard a little bit of cracking, so that's definitely something that we can improve. Okay. All right, now go ahead and put your arm above your head. Okay. Any pain here?
It's a little tight in my shoulders.
Okay. Come back to center. Let's go ahead and check your spine. very little movement in the cervical spine, which could explain a difference in angles. Right shoulder is more elevated than left, and that just indicates there's a little bit more fluid buildup and inflammation on the right side. Okay. The chances of you having scoliosis or any abnormal curvatures are very small. We don't usually see that in gymnasts. Any pain here?
No.
Okay. Got a little bit of change in temperature. It is kind of warmer on the right side. Scapula angle is inwards. Okay. I'm going to put gloves on and I'll examine your shoulder. So I understand that you're experiencing some shoulder and back pain. Okay. Just going to move your hair, put it in your back. Okay. I'm looking at the collarbone ankles. I'm noticing slight increase on the left side. Where is the pain located? It's here right above, like over here. And in the back as well, right? Okay. Let's see. Just going to write down some observations that I'm noticing. So, some muscle movements. And we're going to check cartilage as well. Just looking at the left shoulder. Slight inflammation around the fossa. Not noticing any increased subtissue. Okay. Slight angle elevation with the neck area. Just gonna have you turn your head towards the right. Okay, I'm definitely gonna have to use acupressure techniques to help with the inflammation that you're having in this part of the tissue. noticing a little bit of redness, so that could be some decreased inflammation. Go ahead and turn your head towards your left. Okay, I'm going to move your shoulder. So we're going to make a 90-degree angle. Any pain when doing that? A little bit. Right, I'm not hearing any cracking. Okay, I'm going to listen. I'm going to listen with the stethoscope. Okay, I was able to hear a slight cracking noise. Go ahead and relax your elbow. Okay. Looking for any fluid buildup. Let's check the other side. And relax your elbow. Relax your arm. Okay. I'm gonna have you turn around and I'll take a look at your upper spine. I'm going to put your hair up so that we can expose the spine. Starting with C1, here we have Atlas, and C2 axis. So I'm trying to figure out if there is a decreased mobility that comes from the Atlas. Okay, I'm gonna have you relax your head. I'm going to make some movements, okay? Any pain? No. Okay. Go ahead and lower your chin. Try to touch your chest with your chin. Any pain here?
Yes.
Yes. Okay, come back to center. Okay. Palpating trapezius muscle. Does feel tense. Slight elevation on the right side. Okay, moving down to C3 and C4. Okay. And here we have D1, 2, and 3. These are the points that I'm definitely expecting you to have slight tenderness. Does it radiate down the spine?
Yes.
Okay. I'm going to check your scapula now. Just sliding at least 2 fingers under, and that's very difficult, so that's a good indication of good muscle movement. Hi Elena, thank you for coming in. I'm Dr. Matt. I'm going to do your chiropractic adjustment today. Go ahead and tell me, when did the pain start?
Around 3 weeks.
3 weeks ago. And is it due because of an accident? What happened?
I don't remember actually. It started when I'm driving mostly. I notice it when I see it in the car like for a long time. So, but no, nothing specific.
And is it more on the right or left side?
More left.
Okay. Is it going in your shoulders at all?
Shoulder, and it's going down to my arm. So it's a little bit hard to, be fully free like this.
Any head injuries?
No, not really.
Okay. Any spine or neurological disorders for your history?
No, I don't remember.
Any surgeries?
No.
Okay. Have you ever had broken bones, or were you ever in like a bike or car accident?
No, never.
Okay. And how is your mobility? Are you able to move your head? And
I know it's hard to dress up a little bit, so it's uncomfortable with pain, and sleeping also. It's not usual, like you have to pick the one side. So.
Okay. Have you ever been to a chiropractor before?
A couple of times.
Okay. How long ago was that?
Many years ago. Two, 3 after a baby. I think it was 3 years ago.
Do you work out? Do you exercise?
Yes, not every week, not consistently, but yes.
Okay.
Yeah.
Yes, I'm just trying to figure out
why, it causes a problem. Yeah, maybe because of the sitting a lot in the car. I don't know.
So it does get more when you're sitting down driving. It gets higher.
Yes,
in intensity.
definitely.
How would you rate it on a scale of 0 to 10?
Sometimes even 7.
A 7.
Yeah.
Is it radiating down the leg?
It's more like kind of this side of the, like a lower back.
Lower back, okay. So that could be something called sciatica. It's a nerve that is impinged, and if you're putting a lot of pressure on that nerve, then it can cause that shooting pain that you're describing. It's more on one side, right?
Yes.
Okay. All right, so we're gonna do an assessment. First, I want to see your spine mobility, your gait, and to see where there is a hypomobility. And then we're going to be very sure of where the treatment should be localized, and we'll make sure that we lower that inflammation.
Okay.
All right, I'm gonna have you stand back up. Okay, I'm just gonna have you take a few steps. Don't focus on your gait. Just walk normally and relaxed. Okay, good. Keep on walking. I'll have you turn and walk towards the opposite wall. A little bit of pronation on the left side. Go ahead and come towards me. Okay, and again, turn around. Just a few more steps. Okay, I'll have you stop. This part right here. The left foot is kind of pronated interiorly. Okay. Just palpating the lumbar region. I'm looking for any bulging around the vertebrae. Let me know if you feel any pain as I'm palpating. Okay, slight bulging here at the joint. Okay, I'm gonna have you do a few moves so that we can tell where the imbalance is. I'm gonna have you push in with your heel in front of you. Perfect. That opens up the spaces. Good. Come back to center. Let's do the same thing with the right foot. How is this? Does it hurt when I press down here?
A bit uncomfy.
Okay, go ahead and come back to center. Okay, with your right hand, I'm gonna have you slightly touch on this side here, your right knee. Let's do just right here. Sorry. Over here. Okay, go ahead and come back to center. So without twisting your body too much, kind of do this just as much as you can. There you go. Okay. Come back to center. Same thing on the other side. There you go. Okay, come back to center. Okay. I'm going to check your scapulas. Just going to slide my fingers here. I'm going to have you put your arm right at a 90-degree angle. There you go. Now elevate it above your head. A little bit more. More? Okay. Go ahead and bring it back down. Okay. Same thing on the right side. Okay, just hold it there. Okay, now I'm gonna have you elevated above your head. A little bit more, more. Okay, that's good. Bring it back down. Okay. Hi, Aliana.
Hi.
My name is Dr. Matt. I'm going to do your exam today. Go ahead and tell me what's going on.
So recently I've been playing track and basketball a lot, and I feel like my spine has been giving me terrible pain. It's been bad for maybe about like a month now, I would say.
Okay. And on a scale of 0 to 10, how would you rate your pain?
Like a 7.
7. Is that constant or it comes and goes?
It comes and goes.
Okay. Does it radiate anywhere laterally, like on the shoulders or hips?
Maybe specifically like my lower back, like left area, I would say.
Okay. And are you experiencing any headaches?
I am.
Okay. Where are they localized?
Right behind my eyebrows. So I just feel like an intense sharp pain there.
Okay. It could be related to the spine. We're going to take a look and see if there is any constriction of the blood vessels that go towards the spine, and to make sure that the main organs are vascularized, including the brain.
Okay.
Are you experiencing any tingling or any numbness in the fingers or toes?
No, I don't think so. No.
Okay. Have you noticed any twitching of your eyes, like moving involuntarily?
I would say rarely, maybe like once or twice, but not consistently.
Okay. Any spine injuries?
No.
What about shooting pain down the back, all the way in the heel of your foot?
Sometimes, not consistently again, but I would say maybe like twice a week. I definitely feel it.
Okay. Are you taking any medicine?
No.
Okay. And do you have any family history of musculature disease or spine disorders?
No.
Neurological disorders? Okay. And you are not in any accidents, like car accident, motorcycle accident?
No accidents.
Okay. And for how long have you been practicing this sport?
I would say for about 6-7 months now.
Okay. So here at the clinic, we do a little bit things more differently than at a regular chiropractic office. We take a look at the spine and we try to integrate different techniques to heal and make sure that we are restoring homeostasis and balance.
Okay.
I'm going to take a look first at your back and your gait to see how you balance yourself, okay?
Okay.
Okay, Aliana, go ahead and take a few steps towards me. So we're looking at the gait and how you balance your feet. Keep on walking. A little bit of pronation interiorly. Good balance on the cubicle side. Good. No inclination there. Just take 2 steps. That's perfect. Let's take a look at your lower back first.
Okay.
I'm just going to go ahead and lift the shirt a little bit. Okay, slowly palpating the sacral region. So we're looking at S1 and S2 in a vertical position. Just slowly pressing down here. Let me know if you feel any kind of pain.
I feel pain right about there.
Okay. Now, Going to slowly move towards the left side. This is where you said you're experiencing even more pain. So just trying to see if I feel any nodules, knots, or any imbalance in the vasculature. Okay, so let's do one test here. I'm gonna have you push with your heel in front of you, just like this. Perfect. And I'm gonna continue to press down. Sometimes that provides a little bit of space and it allows me to feel a little bit better. Okay, now I'm gonna have you lift your knee in a 90-degree angle. Okay. Come back to center. We're gonna do the same thing on the other side. So first push down in front of you. Any pain here?
No.
I'm feeling a little bit of swelling. Go ahead and lift your knee up. Good balance, I'm not worried. Okay, come back to center. Just palpating the height of the hips. A little bit of supination on the left side. Okay. Just going to lift this a little bit. Okay, go ahead and lift your arm in a 90-degree angle with your thorax. Okay, I'm not feeling anything swollen there. Keep it like that. I'm just gonna slowly palpate. Okay, now go ahead and lift your arm above your head. Any pain here?
Yes.
Okay, come back to center. I'm going to put your hair up. Okay. Slowly I'm going to palpate C1 and C2. I'm noticing a little bit of a straight angle here, and I would like it to be a little bit more curved. I would like C3 to be a little bit more mobile, and that will definitely give you more flexibility and range of motion in the neck area. I'm gonna have you try to touch your left ear with your left shoulder. Good. And same thing on the other side. Good. I'm not noticing any signs of scoliosis. Okay, with your left hand, I'm gonna have you try to touch this point right here that I'm. Okay. Let me go ahead and help you. How's that? Any pain?
A little bit of pain.
Okay. Just gonna slowly press down in the middle of your palm. Let me know if the pain increases or decreases.
Increases.
Okay. Let's go ahead and try that on the right side. How's the pain now?
It feels worse.
Okay. Just going to do the same thing. Press down in the middle. Let me know if it increases or decreases.
It actually decreases.
Okay. Left scapula is a little bit more elevated. I would like to increase circulation in this area as well. Okay. Okay, I'm gonna have you do a 360-degree rotation with your left arm. And now with the right arm. Okay. I'm gonna have you put your arms in front of you like this and try to push in the center. Apply some pressure there. Okay, spine is deviating towards the right as we're doing this. And we would like it to be about 2 or 3 degrees towards the left. Go ahead and come back to center, relax. Now I'm gonna have you try to touch your chest with your chin, okay? There you go. Okay. We definitely need to do an adjustment. Starting with T1, it's a little bit deviated, and I would highly recommend that we try different techniques today. Any pain as I'm palpating down here?
A little.
Okay. Okay. Now, come back to center. The next thing that I'm going to tell you to do is to try to curve your shoulders like this.
Okay.
As if you were to hug someone, but lowering yourself a little bit down, okay? It's going to help me see the thoracic area. Okay, perfect. Okay, come back to center. Perfect. Any pain shutting down the legs?
On my left leg a little bit.
Left side. All right. Hi, Amanda.
Hi.
I'm Dr. Matt. I'm going to do your chiropractic alignment today.
Nice to meet you.
Nice to meet you too. you've been here before. I believe another doctor has been seeing you. So we do have your x-ray on file.
Okay.
How has your pain been?
It's gotten worse, probably like a 7 out of 10.
Okay. So that was about 2 weeks ago when we did the x-ray. We did see a little bit of a gap in between your L1 and L2. Are you having any pain right now, and where is it?
Yeah, in that spot.
Okay. Any pain on the upper body at all?
A little bit, but not as bad as the lower.
Okay. And how would you describe it? Is it sharp, dull, achy?
On the top, it's more dull, but on the bottom, it's sharp.
Okay. Have you been doing any stretches in the last 2 weeks? And are you taking any new medications?
Not any new ones, no.
Okay. So go ahead and tell me again, how did the pain start and how long ago did it start?
It started a couple months ago when I was working out, but it's gotten worse since then.
Okay.
Pretty consistently.
Is the pain constant or does it come and go?
It's pretty constant.
Okay. And when you lay down, does it still hurt?
It gets better when I'm laying down. It's worse when I'm sitting, and it's like the absolute worst when I'm standing up.
Okay. Are you able to sleep at night due to the pain?
Yeah, decently well.
Okay. Are you taking any medications?
Sometimes I take pain medicine, but sometimes it doesn't work.
Okay. Would you say it works more often or it works less?
Recently it's been working less.
Okay. All right. Have you been having any car accidents?
No.
Okay. Any head injuries? Not in the lifetime at all.
In my lifetime I've had a couple concussions.
Okay. And did you lose consciousness when that happened? How old were you?
Like 20.
Okay. And did you go to the hospital? Did you get a CT scan?
No.
Okay. Have you been noticing anything after the accident, or this is just now in the last 2 months that you've been having this pain?
It's more recent.
Okay. Well, I'm asking this because sometimes you could have an accident many years ago. You could have something along the spine or like a side effect of it, and it could be shown many, many years after something that happens in your life. It could be triggering, and that's when we actually find out about it. I'm wondering if the gap that we saw in the x-ray could be due to that. But today I'm just going to take a look at your spine. What we can do is to increase your spine mobility, and that will give more flexibility and more increased blood flow, and that's going to relieve the pain.
Okay.
So I'm going to have you switch into our gown, and then I'm going to take a look at your gait and your hip alignment to see what we can do starting from there, and then I'm going to move up. Okay? Go ahead and take a few steps. I'm just going to take a look at your gait. Just walk normal pace. Don't think about it. Keep on turning. So I'm going to do a few loops here. Pronation on the left side. Okay, that definitely signals the pain that you have in the lumbar side. Go ahead and stop. Just going to take a look here at the lumbar side. This is the pain, right? Okay. Can definitely feel it. Okay, the muscles are definitely tight around the paraspinal spaces. Okay, as I'm pressing down here, I'm gonna have you place your left heel in front of you and slightly press. Does the pain increase or decrease?
Increases a little bit.
Okay, do you feel any pain running down?
A little bit.
Okay, let's go ahead and switch. Okay, I'm just going to find a spot. Does the pain increase or decrease?
It kind of stays the same.
Okay. And no pain down the buttocks. Okay. Go ahead and come back to center. I'm gonna have you sit down on the table and I'll take a look at the whole spine. Is that comfortable?
Mm-hmm.
Okay. Looking at the spine mobility, we have here C1 and C2. Any discomfort when I'm pressing?
No.
Okay. So there is a slight deviation of the spine, starting with T3, T4, a little bit to the left. I'm going to take some measurements to see exactly the deviation that we have. If it's less than 10 degrees, we can definitely fix it in here in the office. Slight inflammation on the right side. In the chiropractic world, it's all about symmetry. So we're looking for any deviations, changes in temperature. So your right side is definitely more developed than left. And that usually happens when we try to compensate for an asymmetry in posture and muscles. Okay. We're gonna do a few tests here. I'm gonna have you raise your arm like this in front of you, creating a 90-degree angle with your torso. Okay, so now go ahead and flip it, bring it back. So flip it back. Oh, sorry. Okay, go ahead and flip it back again. And back. Okay. I'm gonna have you raise your arm above your head. Any increase in pain as I'm palpating right here?
No.
Okay, go ahead and come back to center. And we'll do the same thing on the other side. Okay. Okay, come back to center. Now let's go ahead and do that one more time. And do the same rotation. Okay? One more time. Good. Now let's go ahead and lift it up above your head. Just hold it there for a second. Okay. A slight tension on the right side. Go ahead and come back to center. You can put your arm down. Okay. I'm going to take a few measurements here. We're going to calculate the symmetry. I'm marking the points that we definitely need to check further with the nervous scope. There is about an 8.9 degree angle. I'm going to go ahead and just palpate the shoulder blades. Slight asymmetry here. This is definitely something that we can improve today. We don't want to work on anything that is not an issue. So we're touching only on the points that need a little bit more circulation and flexibility. No pain around the shoulder blades, right? Okay. So with your left hand, I'm going to have you try to touch this point right here where I'm touching you. Okay, perfect. Okay, just finding the point here in the palm. Any pain around the shoulder or shoulder blade as I'm pressing down on your palm? No. Okay. Let's go on and switch. Okay. Right side definitely lower. Any pain here?
A little bit.
So with your right hand, I'm gonna have you try to touch right here. Right, definitely less flexibility on the right side. Go ahead and hold it right here. Just gonna find the same spot again. We have the. Okay. Any pain as I'm pressing down in the middle of your palm?
Yeah, a little bit.
Okay. Is it stronger or less than before?
A little bit stronger.
Okay, go ahead and come back to center. you feel the vibration?
Yes.
Okay. Go ahead and tell me when this stops.
It stopped.
Okay. Same thing. Go ahead and tell me when it stops.
It stopped.
Okay.
It stopped. It stopped. It stopped. It stopped.
Do you feel it now?
A little bit.
What about now?
Yes.
Okay. Go ahead and tell me when you don't feel it anymore.
It stopped.
Okay. Do you feel this? Okay.
It stopped.
Okay. I'm going to check the heat disturbances in the spine. Sometimes it definitely helps when you're just sitting, and according to the results, we might repeat the same test laying down so that we have a good understanding of the nerve points that we need to touch on. Okay. C1, C2 definitely need a good realignment. Okay, we're looking at T3 and T4. Okay, I'm going to check the spinal reflexes. So just relax your muscles. If you feel any pain, go ahead and let me know. Sometimes patients complain of a sharp pain. gonna check your reflexes. Go ahead and relax your elbow. Okay. Relax your arm. Good. Okay. Okay, go ahead and relax your arm. Good. Relax. Relax. Good. Relax. Good. Okay. I'm gonna have you lay down. We're gonna start facing up, and I'll take a look at the occipital bone and the trapezius muscle, see if we can do anything to loosen up the fibrous tissue that has been building up. We want to reduce some of this tension before we do any cervical alignment. Okay, I'm going to take your blood pressure. This is going to go on your arm. And I'm going to have you uncross your legs if you can relax. Blood pressure is 121/60. That's good. That's normal. So it's good that we're, excluding some of the things so that we know exactly what we're working on. I'm going to have you stand up now. Okay. All right, Emma, I'm going to have you take a few steps towards me, and I want you to walk as normal as possible without thinking of the speed. And I'm just going to take a look at how you place your foot on the mattress, how you balance yourself, and let me know if you experience any pain when you do that. Okay, all right, go ahead and take a few steps towards me. Okay. Imbalance on the left hip, go ahead and turn. Take a few more steps, just walk normal. I'm gonna have you stop. Let's take a look right here. This point. Checking lumbar region. We're looking for any dysplasia of the vertebrae. Soft tissue is definitely a little bit swollen. I would say there's a dislocation between L1 and L2. Not too much, just like a 0.3 degrees. Sometimes we just want to watch that kind of thing and see how it evolves. Just slowly palpating to check for any abnormal movement. Okay. Paraspinal muscles are pretty tight, which means you're putting pressure somewhere, so we just need to find that spot. And that's where we definitely need to work on increasing your spine mobility. I'm gonna have you push down with your left heel in front of you, just like this. Okay. Okay, I'm gonna have you come back to center. And let's do the same thing on the other side. And okay, good. Come back to center. Right, as we're here, go ahead and try to touch the lateral side of your knee. Come back to center. Let's do the same thing on the other side. Come back to center. You do have a little bit of flat feet, so definitely it can trigger some pain in the neck. And I'm afraid that this part right here is very tense because of some muscle that you pulled on the lower side, which I can definitely feel it. Okay. Spine is normal curvature, so I'm not seeing any scoliosis or beginning of lordosis, so that's good. I'm gonna put your hair up. So now we can take a look at the spine. Is it okay if I take off the necklace?
Absolutely.
I'm gonna look at the symmetry of the neck. Starting to palpate C1, C2, C3, C4, C5, C6, T1, T2, T3. Okay. Palpating the occipital bones and the 6 regions that correspond to main pressure points. Shoulders don't look bad. Very slight asymmetry. Let's go ahead and just take a few measurements. A little bit of redness. Slight inflammation on the left side. That could be just stuck lymphatic fluid that we can definitely help stimulate today. Right side is definitely tighter than left. Let's go and take a look at your scapulas. Sometimes even these may be misplaced and have a slight imbalance. That is 44. 3. Going to palpate shoulder blades, so we're looking for any fibrous tissue that has been building up. That's something that we can definitely help to increase the mobility of the upper back. So I'm going to have you try to touch this point right here with your left hand. Okay, let's go ahead and go a little bit higher. That's pretty good, I would say. Any pain as I'm pressing down here?
A little bit.
Okay, let's go ahead and switch. And now we'll do the same thing with your right arm. Okay, there it is. Go ahead and try to touch over here. Okay. Any pain as I'm pressing down?
Yes.
Okay. Go ahead and come back to center. And I'm gonna have you try to put your arm up in a 90-degree angle. Just going to palpate as you're doing that. Right here in front of you. Okay. Okay. Come back to center. And we'll do the same thing with your right arm. Go ahead and put it in a 90-degree angle. And this side definitely looks a little bit better. I'm gonna have you put your arm above your head. Bring it back down. Good. So I didn't hear any extra sounds. Go ahead and bring it back to center. And we'll do the same thing with this side. I'm gonna have you touch your shoulder with your right ear. Good. Come back to center. Let's do that one more time. Come back to center. Okay. And we'll do the same thing on the other side. Try to touch your shoulder with your left ear. Any pain here?
A little.
Come back to center. And let's do that one more time. Come back to center. Just one more time. Any pain now?
On the side of my neck.
Okay, come back to center. Okay. Hi, Angelina.
Hello.
Thanks for coming in.
Thanks for having me.
Absolutely. So, you're having some more back pain.
Mm-hmm.
Go ahead and tell me, how long has this been going on?
So this has been going on for the past few weeks. I've kind of been feeling some pain up in my upper shoulders, and then also like within my lower back as well.
Okay. Have you noticed any rashes or itching?
No.
Okay. Have you been traveling outside the country lately?
Mm.
Any injuries to the back, to the shoulders, the head?
Not recently, but I had injuries a few years ago.
Okay. And tell me more about it.
I was in gymnastics and I had landed on my neck, and ever since that injury, I've had some back pain.
Okay. And are you noticing any indigestion or any cramping, especially before your period?
Yeah, I have noticed some cramping, but everything else has been normal.
Okay. And is that something new or something that has been going on after the accident?
I wouldn't say it's new.
Okay. And do you remember if you were having the same symptoms before the accident?
Yeah.
Okay. So that must be something that is related to your normal cycle. Um, any numbness around the back or down the fingers?
No, it's never down the fingers or anything like that.
Okay. Have you noticed any increase in headaches?
Yeah, I've noticed an increase in headaches, and then also the back of my neck does tend to get sore at times.
Okay. All right. We can definitely take a look and see how the alignment looks. And one last question. Are you having any pain down your back going to the sole of your foot? Okay. So we're going to check for sciatica too, just to rule out and make sure that there's nothing imbalance in the hips. And we're going to look at the cervical spine and see how that feels. Okay. So go ahead and stand up for me. Okay, so go ahead and take a few steps towards me. Okay, turn around. Keep walking. Just looking at the gate and how you place your feet. Go ahead and come back on the mat. All right, keep walking towards me. I'm going to have you turn around. Let's take a look at your back now. Okay, I'm going to feel my fingers just pressing down on the spine. This is where the pain is located, right?
Yeah.
Okay, as I'm pressing down, I'm going to have you try to touch with your left ear, your left shoulder. Okay, come back to center. And let's do that again on the right side. Okay, come back to center. Now go ahead and try to touch your chest with your chin. Okay, curve and curb your shoulders inside as you're doing that. Try to touch your chest, okay? Come back to center. Okay, just going to palpate trapezius muscle. And not feeling any increased tension here on the left side. Let's check right. Okay. Go ahead and lift your arm up. So we're going to do a 90-degree angle. Just going to slowly palpate around the shoulder area. And come back to center. Okay, now go ahead and move your arm away from your body. So basically we're testing different grip muscles to see exactly where the pain originates. Come back to center. So let's check the other side. Perfect. Any pain here?
No.
Okay, it does feel like there's a lot of tension, feeling a knot in the back of the chromium. Okay, now go ahead and come back to center, and we're gonna do the same thing. Okay, any pain here?
No, it's just a little tight.
Tight. Okay, we don't want that. Okay, come back to center. So, just going to slowly palpate around the spine. I'm just gonna move this I cannot move it. It's okay. No, I'll just leave it. Okay. Just going to slowly palpate around the spine. Okay. Go ahead and relax your hand. I'm going to have you try to touch right here where I'm touching you right now. Okay. So I'm going to press down on your palm as you're trying to do that. Go ahead and tell me if you feel any pain anywhere.
Just near my shoulder blade.
Okay. Is it coming from here?
Just about there.
Okay. Just like I suspected. So there's an impinged nerve that we can definitely try to loosen up. Let's go ahead and check on the other side. So just let me find the spot. Okay, go ahead and try to touch right here. Perfect. Okay, a lot better mobility on this side. I'm going to do the same thing. So I'm going to tap. Any pain? Okay, just going to slowly press down. Any pain? Okay. Okay, checking your lumbar and sacral region.
It's a little sore there.
Okay, and is it moving down?
No.
It stays there. Okay. Okay, quite a movement here, so that's good. Okay. All right. We're gonna go ahead and take a look at your posture and gait and see if we are noticing any deviations of the spine. Okay. Something that could definitely be adjusted today, and we'll go from there.
Okay.
All right. I'm gonna have you stand up now, and go ahead and. So I'm gonna start from there. Okay. I'm gonna have you walk towards me. Okay. All right, a lot of cracking I hear. Go ahead and turn around and go towards the wall now. Okay, come back. I'm noticing some pronation and definitely a lot of twisting. Keep on going. Okay, that comes from the feet. Okay.
Yes.
All right, keep walking. All right, go ahead and walk one more time. All right, I'll have you stop. Come towards me and turn around, facing the wall. Okay, I'm just going to go ahead and palpate your sacral and lumbar part. Let me know if you feel any kind of pain. Okay. I'm going to have you lift one leg up. Go ahead and start with the right. Okay, come back to center. And I'll have you push with the heel in front of you. Okay, a little bit of imbalance there. Moving to the right hip. Come back to center. And I'll do the same thing. Lift in a 90 degrees. Okay, come back to center. And now push with the heel in front of you. Okay, and come back to center. Okay. Let's go ahead and check your shoulders now. So go ahead and relax your arm. I'm going to guide you. Any pain here?
No, not really.
Okay. The pain is more on the upper side? Okay. Go ahead and lift all the way up above your head. Okay. Come back to center. I'm going to have you try to touch the back of your shoulder here with your hand. Okay.
A little pain there.
Well, scapular mobility is, I would say, at 10%. Okay, go ahead and move that. And we'll do the same thing with this one. Any pain here?
Not really.
Okay, go ahead and lift it all the way up. Any pain there?
Yeah, a little.
Okay, come back to center. And now go ahead and try to touch the back of your shoulder. Wow, okay. So a lot better mobility towards the left side. We're gonna have to keep on assessing here. Okay, I'm just gonna go ahead and start looking at your back here, starting with cervical spine. Okay, I am noticing a little cervical inflammation. Any pain as I'm sliding down my fingers?
Not really.
Okay. Any pain here?
A little more there.
Okay, so that's the junction with the thoracic. And definitely a lot of inflammation here. I would say it's more like lymph fluid. We could definitely help with a lymphatic massage in this area. And also we will do some adjustment in the shoulders. Now I'm looking at the angles, slight elevation at T1, C7. Okay, I'm gonna have you bend down like this. I'm just going to check for any deviations. Okay, no scoliosis, no lordosis. All right, go ahead and come back to center. Hi, Emma.
Hi.
It's nice to meet you.
Nice to meet you too.
I'm Dr. Matt. I'm going to do your exam today. So tell me a little bit about your back pain.
Yeah, so I've actually started climbing recently. So I have like a pain in my shoulder when I try to lift my right arm.
Okay.
And then it kind of like goes up into my neck on the other side. So then also when I turn my head, it like hurts on this side as well.
Okay. And for how long has that been going on?
A couple weeks. Yeah.
Right. Any injuries to the neck or head?
No.
Okay. Have you had any surgeries in the last 12 months?
No, I'm not.
Okay. Any car accidents in your lifetime?
Yes. I rear-ended someone once, but no one was hurt. But it was abrasive.
Okay. Did you have any post-injury?
Not that I noticed.
Okay.
Yeah.
Are you wearing glasses or contacts?
Contacts.
Okay. Have you noticed that you're having more frequent headaches or something
Actually,
like
yes, I have noticed that, yes.
that? Okay. And when do you think they started?
Probably about the same time now that I'm thinking about it, yeah.
Okay. Are they constant or they come and go?
They come and go. Thank God, yeah.
Okay. And on a scale of 0 to 10, how would you rate your pain in the neck and shoulders?
Maybe like a 6 or a 7.
Okay. And if you take Tylenol, does it go away?
Yes.
Good. Are you able to exercise still, or is it limiting?
Limiting.
All right. Is it radiating down to the fingers?
Not
or
yet.
The shoulder?
Not yet. It's like upper arm sometimes if I'm like climbing, but not all the way down to my hands yet.
All right. Are you having any lower back pain?
Yes.
All right. Are you taking any medicine?
Just the Tylenol.
Do you have hypertension, or do you have hypertension in the family?
Not that I know of.
Okay. I do want to check your blood pressure before we start, just to make sure that it's not related to the headaches or that it's not interfering with the pain.
Okay.
And we're gonna check your gait. I want to see exactly how you balance yourself, how your spine looks. If there is any asymmetry, we're gonna have to fix that. And today, hopefully, we're gonna be able to put you back together and help you out with that.
Okay, I'm gonna have you take a few steps towards me. Just walk normal. All right, turn around and keep on walking. I'll tell you when to stop. I see a little bit of pronation there. Go ahead and turn. And I'm going to just take a look at your shoulders. You are having some neck pain as well, right here in the back. Definitely there is an elevation on the right upper shoulder area.
Yeah, just
Some
always
imbalance.
notice like this little bone here is kind of higher than the other side.
That's just muscular. It's how you're tensing your muscles, and probably you're trying to compensate. Okay, go ahead and raise your right arm. Okay. So I'm gonna press down on your arm.
Okay.
Try to keep it up.
Okay.
And resist. Okay. Let's go ahead and do the same thing on the other side. So try to resist. Okay. A little bit of decreased motor texture there. Okay. Can you try to touch your chest with your chin? Okay. Your head is going to the left side. Are you noticing that? It's not going center. Okay, lift it back up. And now try to hyperextend. Again, you're going to the right side instead of going center. Okay, come back to center. I'm going to touch some trigger points on your face. Let me know if you feel any kind of pain. Okay, good. I'm going to have you turn around. I'll take a look at your spine now. Okay, I'm sorry, my hands are a little bit cold, but I'm just gently pressing down on the spine level, feeling for any inflammation. Also looking at the curvature, see if there's any deviation, any angle differences. It does feel kind of tight. I would say it's symmetric on both sides, and that can explain the angle. You are turning naturally towards your left side. Okay. With your left arm, I'm going to have you touch exactly this point that I'm pressing down right here. Very good. Okay. Any pain when I'm pressing down in the middle of your palm?
No.
Okay. Just going to go ahead and gently press down under your scapula, checking for mobility here. Okay, and now I'll do the same thing with the right arm. How does that feel? Any pain?
Good. No. No pain.
Go ahead and come back to center. And you did mention that your pain is mostly in the upper side here. So it does sound that it's muscular. We can definitely do a trigger point massage and just an adjustment to put your spine back to center. And after that, I'll give you some recommendations that you can definitely do on your own to increase spine mobility.
Okay.
All right, let's take a look at your hips now.
Hi.
I'm Dr. Matt. I'm going to do your chiropractic assessment. Go ahead and tell me what brings you in today.
Yeah, I'm having a lot of back pain and some neck pain and some shoulder pain. And the back pain is mostly my lower back.
Okay, that's a lot of back pain. For how long have you been having this?
Probably 3 or 4 months now.
Okay. And on a scale of 0 to 10, how would you rate your pain?
Like an 8 or 9.
Okay. Is it sharp? Is it dull? Is it achy?
It's sharp and achy.
Okay. Do you remember doing something in particular that could have caused this?
Not specifically.
Okay. And did it start slow, or you just woke up one day
It's just
having
been
this pain?
gradual.
Okay.
I just finally had to come see you because it's a lot.
Okay. Have you had any x-ray done or CT scans?
No, I'm not.
Okay. And are you experiencing any pain when you move your neck?
I am, yeah.
Okay. Is the pain going up to the head as well, or it just stays in the neck and shoulders?
It's in my head as well.
Are you taking any medications on a daily basis?
Yeah, lots of ibuprofen.
Okay. And did you have any car accidents, any injuries?
When I was younger,
Okay. Tell me more about it.
we rear-ended someone and it was pretty bad.
Did you have any car accidents or any injuries that could relate to the back pain?
When I was younger, I was in a car accident, but it wasn't super severe. And
Did you injure your head?
I think yes, I think there was a moment where I had like a whiplash kind of thing.
Okay.
I thought I'd recovered, but
That's really important information. It could help with the diagnosis and for us to know exactly what kind of treatment to do.
okay.
And okay, I'm going to take a look at your back. So what we do is to see how your spine moves. So we check for spine mobility, and according to that, we adjust the parts, only the parts that need to be more mobile, so that it allows for a better circulation and more nutrient delivery to your spine. I'm going to first take a look at your back, and we're going to check your shoulders, your cervical spine. All right, I'm going to have you face the wall for me. I'm going to put your hair up, and I'll take a look at your neck. Some range and motion test to see for any hyper or hypoflexibility. So slowly I'm just going to palpate right here. Okay, definitely on the left side. There is an obstruction. Just putting pressure on some of the main points that, if they're tender or swollen in any way, definitely could indicate which part of the spine we need to adjust. So there is a region right here in the back of the neck and head that has 6 points. 1, 2, 3, 4, 5, 6. And these points correspond to main organs that are responsible for the balance, homeostasis of the body. Okay, so I'm just going to gently press on each point. Go ahead and tell me if you feel 1, 2, or 3 tenderness or pain.
1. 1.
Okay, this is point 2.
2.
Okay, let me go ahead and find 3. Okay, this is 3.
2.
So that is the neurological part of your system. And right here we have digestive, which, are you having any heartburn?
I am, yeah.
Okay. Let's go ahead and check the other side. And this is the 4th point.
1.
Okay. 5th.
2.
And 6.
3.
So the 3rd one is the reproductive part, which could indicate an hormonal imbalance. Any issues with your period lately? Was it irregular, more or less?
It has been a little irregular.
Just going to slowly move your head to the left. Let me know if you feel any pain. 0, 1, 2, or 3 pain.
1.
Okay.
2.
Okay. Just going to slowly apply some pressure here. Go ahead and move up. Any pain?
1.
Okay. Go ahead and try to touch your chin with your chest. Any pain?
2.
Okay. Come back to center. Let's take a look at your thoracic and last cervicals. I'm going to palpate your scapula and around it. We're looking for any fibrous tissue that has been building up. That usually tells how mobile your scapula and shoulder blade is. I'm going to have you try to touch with your left hand right here where I'm pressing. Good. I'm going to gently push down on your palm. Go ahead and tell me if you feel any pain.
1.
Okay. What about if I press now here? Do you feel the same amount of pain, less or more?
More.
More. Okay, go ahead and relax. Let's do the same thing on the other side. Okay. Go ahead and tell me 1, 2, or 3 for pain.
1.
Now I'm just going to find the exact point here. go ahead and tell me if it's the same, more, or less.
The same.
Okay. Just palpating around the shoulder joint. We're trying to compare. This is definitely the one that is kind of underdeveloped, I would say. You're using it less and you're using your left side a little bit more, compensating for the right. And that's what is causing the strain in your back. I'm not feeling any broken ligaments. Going to do a few tests here, so just relax your shoulders. Relax your arm. Okay, go ahead and relax. Okay. We're just doing a few nervous scope tests to check for any nerve impulses that are delivered abnormally. Do you feel this the same as this?
They're slightly different.
And do you feel this the same as this?
Yes.
Feel this the same as this?
Yes.
Okay. Hi, Jessie.
Hi.
I'm Dr. Matt. I'm going to do your chiropractic evaluation today. I read in your file that you were having some neck pain.
Yes.
Any pain anywhere else besides the neck?
It's mostly in the neck, from the bottom of my skull to the kind of like parallel to my shoulders.
Okay. Do you have any history of back surgery?
No.
Any head injuries?
No.
And do you remember kind of when it started?
It started a couple weeks ago, so I thought it would go away, but it didn't.
Okay. Were you doing something that might have triggered it?
I think I was exercising, weightlifting, maybe a little improperly, but yeah.
And did it gradually get worse, or have you experienced any on and off relief?
It started hurting like 1 or 2 days after, I think, the initial injury, and then it's kind of stayed the same since that.
Okay. Do you have any history of hypertension, high blood pressure?
No.
Any history in the family?
No.
Okay. Do you have any history of heart disease?
No.
Endocrine disorders, like thyroid problems?
No, I don't think so.
Okay. Do you bruise easily?
Not particularly.
Okay. And if you have a cut, does it heal by itself pretty fast, or does it take a long time?
I think it takes about average time.
Okay. Have you noticed any changes in your hair texture?
Not that I could tell. My scalp maybe has been a little more dry recently, but I don't know if that's related or not.
Okay. Any changes in your vision?
No.
Okay. Have you noticed any changes in smell or taste? Any numbness or tingling sensations in the fingertips or toes?
No.
Okay. And Any pain in the shoulder blades or the shoulder joints?
There might be a little tightness, like just like radiating from the neck, but not directly on like the shoulders here.
Okay. Have you tried anything to make it feel better?
I've used ice packs, and then I use like heating pads. That gives a little relief, but it doesn't fix it.
Okay. Any shooting pain down your back?
No.
All the way to the leg?
No, not feel.
And have you noticed any imbalance problems? You're maybe a little bit more wobbly.
I feel like with the neck pain, it kind of makes me feel a little dizzy a little bit. Maybe like a little bit of vertigo sometimes.
Okay. And have you ever had that before, or this is new?
This is new.
Okay. Any x-rays that you brought in with you today?
No, I haven't seen a doctor for that yet.
Okay. We can definitely do that. We have it here in the office. Let's go ahead and take a look at your gait, see how you walk, and then I'm going to take a look at your neck, see if you have any joint or vertebrae problems, and we'll do a very thorough evaluation to make sure we do the right treatment. I'm going to have you stand up. Okay, Jessie, go ahead and just take a few steps. Walk normal. Try not to look down for me. Okay. One more. A little bit of pronation on the right side. And no pain shooting down.
Not that I can tell.
Okay. Just one more time. I'm just gonna have you stop right there. I'm gonna put your hair up. Perfect. Okay, I'm going to palpate starting with the cervical spine. Let me know if you feel any kind of pain.
Yeah, there's just a little bit.
And does it feel sore or sharp?
It's more sore and dull.
I don't see any type of bruising. There's no discoloration around it. Any pain here on the lateral?
No.
Just a slight swelling. Okay, I'm going to slowly palpate. On a scale of 1 to 10, how would you rate the pain?
It's like a 7.
Okay. I'm gonna move down. How would you rate it now?
That's more like a 7.5, 8.
Okay. So that's C2. What about now?
About the same.
No?
Around the same still. That's more like a 7, 6 or 7.
And now?
Maybe like a 4 or 5.
Okay. What about here?
That's around a 4 or 5.
Okay. I'm just gonna have you look down. Any sharp pain down the spine when you look down?
No.
Okay, go ahead and come back to center. I'm gonna have you try to touch your left shoulder with your left ear. Okay, go ahead and relax. And now try to touch your head with your left shoulder. Is there any increase in pain?
It's just the same pain.
Okay, come back to center. Let's do the same thing on the other side. Okay, now try to touch your head. Is there any increased pain?
No, the same.
Okay. left shoulder slightly delayed. No signs of scoliosis. There is a slight deviation of the angle. I would say like C6 over here. We want to make sure that we are adjusting just the right points that need an adjustment and realignment so that we increase your spine mobility. Slight deviation to the left. It's like a 1 or 2 degree. I'm going to palpate your scapula, so we're looking for any fibrous tissue, any hardness that accumulates, and it's really keeping your spine from moving. That immobility sometimes can cause blockages. Okay, I'm gonna have you put your arm like that in front of me. Okay, now above your head. Now try to touch your neck with your hand.
Like this?
Mm-hmm. A little bit lower. Lower. Okay, perfect. Just wanted to see how extensive the shoulder blade is.
Mm-hmm.
Let's go ahead and check the other side. Slight elevation on the right side. Do you have more pain on the right or left?
I think my right side.
Okay, I'm gonna have you try to touch this point right here where I'm touching you.
Like this?
Mm-hmm. See if you can reach it. Perfect. Any pain when I press down here?
Yeah, like
The beads over here.
Mm-hmm.
So that's referred pain. And I don't think your inflammation is coming from here. It's just some tightness that you have in the thoracic area, and it's radiating to the base of the scalp.
I see.
Slight inflammation on the right side. Go ahead and put your arm like this. Above your head. Is your pain increased or decreased as you have your arm up?
I think less than when it was like here.
Okay. Go ahead and relax. I'm gonna take some measurements so that we can see the imbalance. wake up in the morning, are you noticing any increased stiffness in the neck?
Yeah, definitely.
There is about 2-degree angle. I'm going to try to balance that and bring it to a 0. I'm going to palpate the lumbar area. Let me know if you feel any kind of pain. We're just looking for any inflammation around the paraspinal muscles. And sometimes imbalance in the lower lumbar can really trigger nerve pain up the neck. It's really good to know if we need to do a hip adjustment. Any pain here?
I feel like there's a little bit of tightness.
Okay. Just gonna have you twist with your torso, slide towards the left wall. Any pain as you do that?
Not really.
Okay. Go back to center. Okay, let's do that one more time towards the left. And now come back to center. Now let's do the same thing on the right side.
Oh, yeah.
Okay, so that's definitely a sciatic pain nerve. Did you feel any pain down the leg?
No, it was mostly contained in like the torso.
Okay. We're just gonna have to do that one more time. Turn towards the left wall. Come back to center. Same thing towards the right. Come back to center. Okay, I think I know what we need to do. Definitely there is realignment so we can increase the spine mobility, and we want to make sure we bring in more blood flow to the paraspinal muscles.